Blood-brain barrier. What is blood-brain barrier? It's a special structure that separates blood vessels inside of the brain from the brain cells, neurons. And that separation happens through astrocytes. Astrocytes are glial cells that are connected both to the nervous cells, neurons, brain cells, and to the blood vessels. They connect to the blood vessels through special astrocyte end feed or food processes right here at the end, food processes. And those food processes surround the blood vessel. So when different substances, nutrients go from the blood, first they go into the astrocytes and then later they go to the neurons. So astrocytes provide a selective barrier. They allow nutrients to move to the brain, and they allow all fat-soluble substances to pass, but they stop water-soluble substances that can be toxic for brain. Many toxic substances still can go to the brain cells if they are fat-solubles, like alcohol, nicotine, some other drugs, and also anesthetics. Some areas of the brain, still can receive chemicals from their blood because it's necessary to monitor chemical composition of the blood. Example would be hypothalamus. That's where astrocytes are absent. Blood supply to the brain. There are 4 arteries that carry blood to the brain. The first one right here would be internal carotid artery. There is a right and left internal carotid arteries. And the second one would be vertebral artery. Also there is vertebral right and vertebral left arteries. So if we look at the base of the brain from the inner side of the brain, here are those 2 right and left internal carotid arteries. Those are vertebral arteries, left and right. And the vertebral arteries merge together, forming basilar artery, and they form a circle with those internal carotid arteries. That circle is called cerebral arterial circle, or circle of Willis. You don't need to memorize all those arteries, but you need to know 4 arteries: internal carotid, right and left, vertebral right and left, and circle of Willis. Why that circle exists? If one of those arteries is blocked, for example, or damaged, brain cells will still receive blood from 3 other arteries. Most common problems of the brain or homeostatic imbalances of the brain are caused by trauma, brain injuries. Concussion is a temporary damage. Usually it goes away, sometimes in several days, sometimes in several months, but it goes away. Contusion is a permanent damage when a patient would have some certain symptoms through their whole life. So, hemorrhage, it's when blood vessels burst. It can happen under dura mater, between dura mater and the arachnoid, or it can happen in subarachnoid space. Doesn't matter where it happens, blood keeps going through the damaged blood vessel into the brain, and if a lot of blood goes there, it can cause brain death of the patient. Cerebral edema is swelling of the brain, also associated with head injury. Why swelling of the brain is so dangerous? Brain, when it's swollen, it has nowhere to go. The only opening is foramen magnum, and if brain starts pressing into foramen magnum, what part of the brain will go first there? Medulla oblongata. And you remember that medulla oblongata has all those centers, cardiovascular center, responsible for the heart rate and breathing center. So the heart will stop, breathing will stop, and the patient will die. Okay, another type of brain problems would be strokes, or they are called cerebrovascular accidents. It's when blood circulation is blocked completely from the brain. Let's say blood clot blocks an artery, or sometimes artery bursts, causing bleeding inside of the brain. Damage depends on where exactly in the brain it happens. If motor centers are damaged, it can cause hemiplegia. Uh, if some sensory areas are damaged, then the person cannot hear, for example, or cannot see anymore. And finally, speed deficits and speech problems also can happen. Uh, when strokes are temporary and mild, it's called transient ischemic attacks, TIAs, and those are reversible. But person who once had TIA, they are in a high danger of having a real huge stroke sometime in future. There is only one treatment of stroke known for now, and it's TPA, or tissue plasminogen activator. You need to know stroke signs. There definitely will be question about stroke signs on your test, and here is a link. You can find that link in the PowerPoint, or just go on YouTube and type stroke signs by Pfizer. The last thing you need to know about brain is cranial nerves. Cranial nerves originate of the brain. They are attached to the brain. There are 12 of them. They all have Roman numbers from 1, 2, 3 all the way up to 12. And they can have one of three functions. They can be sensory, like olfactory or optic nerves. They carry information from our nose or from our eyes to the brain. They can be somatic motor, like glossopharyngeal nerve. They activate skeletal muscles. Glossopharyngeal nerve activates part of the tongue. And finally, parasympathetic nerve, main is vagus, goes all the way down to the thoracic cage and provides parasympathetic innervation of a lot of glands and organs, muscles inside of those organs, in the thoracic and even abdominal cavities, like our heart, our stomach, intestines. That's exactly what you need to know about cranial nerves. Everything is in this table. So number, always put number. Olfactory nerve, number 1. Function is responsible for smell. Optic, number 2, responsible for vision. Oculomotor moves our eyelids and eyeballs. Trochlear, number 4, innervates one of their eye muscles and also helps to turn our eye downward and laterally to the side. Trigeminal, responsible for chewing and feelings of touch and pain in the face and mouth. Abducens, number 6, turns our eyes laterally. Facial, number 7, controls most of our facial expressions muscles and also secretion of saliva, tears, and sense of taste. Number 8, vestibulocochlear, or also called auditory, is responsible for sense of hearing and balance equilibrium. Glossopharyngeal, number 9, responsible for taste, and also it senses carotid blood pressure in the large carotid arteries in the neck area. Vagus, number 10, can sense blood pressure in aorta, can slow down heart rate, and stimulate our digestive system organs. Number 11, accessory nerve. It controls big muscles, trapezius, sternocleidomastoid, and also swallowing. And hypoglossal, number 12, controls some muscles of our tongue. If you go on YouTube, you can type the cranial nerve song. It's funny and it can help you to memorize information about the nerves.